of our top stories today, and 7 News exclusively obtained the annual report that Cedar Hill Regional Medical Center GW Health was required to give to the mayor. That 90-page document is labeled as confidential.
Our Washington, D.C. reporter Felicia Ashley has been covering issues inside the hospital for months now. She joins us live from the D.C. Bureau. So, Felicia, you took the time and went through all 90 pages. What did you find?
All right, well, what we learned is that this report could set the tone for the direction the mayor could decide to take with this hospital. The deputy mayor for Health and Human Services said before this report came out that this would give the mayor a view inside to see if the hospital kept up its part of the deal in its agreement with the district. After 3 months of requests, I obtained the annual report that Cedar Hill sent to the mayor back in May. DC's Deputy Mayor for Health and Human Services, Wayne Turnage, said the report is supposed to give the city all the details of what is or isn't happening inside.
My expectation is that once we see that annual report and see what the level of performance has been, if there are significant indicators of trouble, that certainly within 6 months, those troubles will be addressed.
In the 90-page document, it revealed the number of inpatients at the hospital didn't meet projections. In its first year, it had to utilize a staffing company and fill-ins due to turnover. The report shows Universal Health Services did not reach its goal for patient experience in communicating with patients about medication or with hospital staff responsiveness. The report, though, also revealed major milestones for the first year of a hospital that was built from the ground up. It delivered its 100th baby this May. Patients' length of stay is below the national average, and the length of wait time has dropped. It hired 168 district residents, surpassing the city's requirement of 67. It opened a medical office building in December and says it's in the process of opening a freestanding emergency department on Benning Road. A lot of growth here and a change for the hospital. One thing we also uncovered, we previously reported serious staffing issues exclusively here on 7 News about the hospital. One thing we learned is that the hospital has increasingly stepped up, beefed up its efforts with community engagement, its hiring events, training, and it has now stabilized staffing within the hospital. I'm going to send it back to you.
Yeah, and those are some positives, Felicia. Now, you've been reporting on issues with the hospital for a long time now. One of them that you found was a citation of something called immediate jeopardy. Explain why that matters.
That's
and did
right.
the report address it?
The report did address, and that was one of the first things I was looking to see if they included that in the report. And that is because, as you mentioned, we exclusively uncovered and revealed that back in March. At a hearing in April, though, the Department of Health insinuated that the hospital did not receive an immediate jeopardy. But as restated again in this document, it confirmed that it did receive an immediate jeopardy. And on top of that, it did also add that it was resolved and it now has been lifted. For now, reporting live from the D.C. Bureau, Felicia Ashley, 7 News.